So putting it in perspective from everybody's KPI.
Exactly. Yeah. Yeah. Think about what they care about. And they care about more than dollars, but it's a big, they consider it heavily. So
Sure.
yeah, that's for sure.
This episode is brought to you by PT Pintcast Media. If you've ever thought about launching a podcast to grow your brand, your clinic, your business, we can help. Reach out at jimmy@ptpintcast.com. Today, imagine blending cutting-edge robotic rehab tech with a private clinic right in the heart of Manhattan. Now imagine the person behind that clinic also helps shape reimbursement policy for one of the most advanced exoskeleton companies in the world. He's a neuro PT by background, a tech-forward entrepreneur by action, and somehow still finds joy commuting by train, even if he's the first to call out a delay. From clinical excellence to a policy influencer and innovation at the street level, meet the founder of Walk in New York, Joshua Breighner, here on PT Pintcast. So what is, I gotta know, we gotta start from the start. What is Walk in New York? How would you explain it to another healthcare provider first? Then maybe
Okay.
how would you explain it to like a potential patient or someone in the public?
Yeah, for sure. So yeah, really Walk in New York came from a vision of sort of like the blending of advanced rehab technologies in a fun space. So, the office is in Midtown Manhattan. And what we're looking to do is really combine advanced rehab technologies and make it accessible for patients. You know, a lot of these new technologies are either at, the big hospital networks and, um, there's wait lists, things like that. So really it's looking to take this private PT practice, make it accessible both from a financial standpoint by going in network with insurances. And on the other side too, just kind of allowing clinicians to have access to tools that make their job easier and allow them to be evidence-based in their practice. So really at its core, that's what Walk in New York is trying to do. It's not just about walking, it's all neuro rehab.
Right.
But yeah.
What's it look like? I mean, this is a podcast and I can bring some stuff up on the screen, but like when you walk in, I feel like this is going to look and feel different than maybe in most clinics.
Yeah, for sure. I'll try to do, like paint the picture. So because, so Walk in New York is sort of the short name, Walk in New York by Wandercraft. So it's in the Wandercraft corporate headquarters there in New York. But there's a section on the Park Ave and 26th Street side that looks like a walking center. It has an overhead rail, very modern look. And that's part of the goal is that patients obviously want to do rehab in a place that feels comfortable. So first and foremost, we want it to have a really modern look, have it be super clean, and be a place that patients want to come. So you'll walk in and you'll see Wandercraft team members doing what they're doing, but then as you go through and move past the waiting area, you come into sort of this like immersive experience where you look to your left and you see someone walking down the street, and the yellow taxi right there in front of you. So that's kind of the experience we're looking to create, and hopefully that's what patients are feeling.
How long have you been there?
So Walk in New York in principle has been a corporation since December. We started seeing patients in February, but I've been with the team here at Wandercraft since April of last, so about just over a year.
Okay. And then what was the inspiration? Like why this thing come about? We talked before we hit record about a lot of people either saying, this should exist, something like this should exist, someone else should do it,
Yep.
or people get real naysayery, which is, well, you can't do that because it's too hard or because insurance or because. So what was the inspiration like that someone just finally said, we're doing this?
Yeah, and I wish I could take credit for the principle of it, but I'll give some historical context that precedes me. Not always an ideas guy, so I'm happy to pick up the pen when there are ideas. So that's kind of what happened here. One of the founders of Wandercraft, and the current CEO, and really the three co-founders had a vision many years ago to create a device that allows someone to stand and walk, and that's what bred sort of the innovation of this robotic exoskeleton that we have featured in the clinic. But they continued that forward and said, it's great to have these devices, but they want to be at the forefront of driving their adoption and their use. And this started so the company is a French company, has headquarters in Paris, and they do the same there, that they have patients come, try the technology, get their feedback. I think that's a really important piece for technology too. But they want to do the same in New York. And New York can be a sticky state to practice medicine. It's the same reason that, all hospitals are a nonprofit structure, or, other major PT companies are PT owned. It really is two ways to do it.
Sure.
So that's sort of the why of, you can't do this, different aspects of that. But the greater part of a year and working with some really expert legal counsel have allowed us to create this structure that allows us to see patients. So which is why you'll see, if you go to my LinkedIn, it says owner of Walk in New York. The PT practice, Walk in New York Physical Therapy, takes decisions for the clinical practice. It ensures that corporations aren't influencing what happens to patients. From a safety perspective, it's really great. So, the PTs at Walk in New York take decisions from a clinical perspective. And then you see that by Wandercraft. Wandercraft is helping to manage some of the logistics that prevent PTs from entering into this startup space, which is, it's really a win-win. We're really happy with how things are going, and we have patients in the door. So that was the end goal. So it's really cool to see it come all together.
Here's the truth. You do the work, you care for patients, you fight through schedules, documentation, and the chaos of healthcare. So why shouldn't you get paid on time? That's where Athelis RCM comes in. It's billing, but smarter, AI-powered, fully automated, and it integrates with your existing EMR. It handles everything from claims to denials and revenue reports. It's like hiring an entire billing department without hiring an entire billing department. And providers are raving about how much time they get back. Not to mention 15 to 20% boost in collections, not too shabby. So yeah, you can have fewer headaches and more money. Just book a demo at athelis.com. That's ATHELAS.com, and see what your billing could look like when AI has your back. From your perspective, what does successful integration of rehab technology really look like in practice? And then what's overrated? I remember when I was a PT student and I would trip across something on the internet and I'd bring it to my professors and they'd sit there and listen as I excitedly explained why this new product was going to change the world. And they would, to their credit, listen and listen and listen. Then they would inhale and say something like, can't wait to see what this is going to do. But like they realized, like I was looking at the shiny new thing and they were looking at it saying, they've seen fads come and go, but you're doing it. You're at the intersection of rehab technology. So from your perspective, I'll ask that question again, because this sounds like the hugest, longest question. I've just gone in circles. What does successful integration of rehab tech really look like? And what, from your opinion, is overrated?
Yeah, it's a good question. And it's very easy to fall in, not what's called a trap, because it's not a trap. It's not bad. We want to explore all the new technologies and really, uptake or shoo them aside, as sort of your professors are doing. Coming from my clinical practice, so I'm a PT, obviously, and neuro focused. So I have my, neuro clinical specialist. Started at one of the model systems hospitals, and those hospitals are driving innovation and really from an evidence-based perspective. And I took to that. But I think the thing for me was, as a new grad, you want to prove yourself, you want to do what's best for your patients, but the hands-on skills and sort of the handling in neuro rehab specifically takes a lot of time. Sure. To really develop that fine craft, and you learn as you go. But I was one who was particularly inclined to use technology because what I felt like it allowed me to do was achieve an evidence-based practice when additional resources were the limitation in doing so. So always asking for an aid. There's shortage on aids to help. And for example, like let's say incomplete SCI, for example, we know those individuals should be up and walking, especially, Asia Cs who have sufficient strength to be up and walking. But I was finding that I couldn't get the help I wanted to do that. So I leaned into robotic exoskeletons at that hospital. I was saying, this device allows me to get patients up. We can take steps before I would be able to otherwise. So for me, as long as technology is driving towards evidence-based practice or facilitating, the principles of neuroplasticity that we know exist, um, that's kind of what my like litmus test is for, do we adopt this or do we not? I think there's devices that are easier for clinicians to use, like that they make clinical practice easy, but they don't always drive neuroplasticity. And that's kind of where, what we're kind of looking to explore with Walk in New York is like, the technology is cool. Is it evidence-based? And is it driving neuroplasticity in what we're doing? And if we can answer yes to both of those questions, we're a go, and should be doing things to promote adoption, like removing barriers. This is hard for clinicians to integrate new technologies. It changes practice. So how do we remove the barriers? So if it allows them to do things they can't otherwise, we should help and facilitate that.
How would you suggest that someone listening overcome one of the biggest barriers, which is cost? Right? Someone's going to look in this and be like, "That thing looks super awesome. How do I make sure a patient can afford to use it? Or how can I get my clinic to buy it? I mean, look at this thing. This thing's awesome looking, right? I mean,
Yeah.
I was not in neuro rehab, but this thing looks awesome, right? So that is definitely one of the barriers. But how do you frame it so someone can break down that cost and spread it out over time?
Yeah, it's a great question. Yeah, and you look at the device, it's like taking someone who can't walk and allowing them to stand. Standing is one thing, but also allowing them to walk and walk in dynamic patterns. It's, when you describe it, it seems like too good to be true. But yeah, cost is a major barrier, and we understand that, which is maybe a good point to sort of like bridge towards the work I'm doing for Wandercraft. So my role at Wandercraft is really at its core market access. Market access is a common practice both in pharmaceuticals, but also medical devices. And really what it's looking to do is, understand the cost of implementation, what does it mean for the patient clinically, but then what does it mean for the health system subsequently based on the clinical outcomes. So you start to think about cost effectiveness when you're thinking about adopting new technologies, cost effectiveness, and also budget impact. And quickly describe kind of what I'm talking about here is, budget impact is really, we integrate this new technology. What is the immediate impact on an overall health system's budget? So that includes the cost to adopt, whether that's a rental or a capital purchase model. And then how does it change staffing costs, for example? Think about a device like the one that you had kind of flashed up. So that's our, Wandercraft's Rehab exoskeleton. With the self-balancing nature, you can see, and, it has the overhead rail, but which is really there just for safety. The clinician, and this is Rachel Higdon. She's a, like a neuro extraordinaire. She's one of the PTs that helps out at Walk in New York. Give her a quick shout out. But she's doing it by herself. So she's able to get an individual with complete paraplegia up in the device, access to standing and walking, and do that by herself, which you think about what it would take to do that maybe on a treadmill-based system or something where you're having 2, 3, maybe even 4 clinicians kind of advance the limb, do the weight shift. There's potential savings there. So really what we're looking to do is sort of take this whole model and break it down for different systems and say, yes, it's a high cost of entry, but are there potential savings in the long term because of reduced staffing costs, maybe reduced staffing injuries with a self-balancing exoskeleton? And then you look to cost effectiveness. It's like, if we integrate advanced rehab technology early in the continuum, does it improve mobility scores that may reduce hospitalizations, reduce falls in the future? These are very hard questions to answer, but ones that we're really interested in exploring because we recognize that cost is a huge barrier.
Understood. My next question would be, what advice would you give to someone, a therapist, somebody in clinical practice, about blending technology into practice? Where should their head go in terms of, how do I start this? I mentioned before we hit record, there's a lot of people who would tell you in a Facebook group, by the way, don't take advice from people in Facebook groups most of the time, or at least do your research. But a lot of people are going to say it's not possible, or it's only possible in a place like New York City. But of course we want to see these things elsewhere. So like, what maybe pieces of advice, or how would you respond to that when someone says it's not possible, or it's too hard, or it's too difficult, or the juice isn't worth the squeeze?
For sure. I hear this a lot, clinicians asking like, we don't have technology, or we don't have a technology that can allow me to do what I'm having trouble doing. And I think my first instinct is like, explore your clinic. Like in a lot of cases, you see these hospitals or private PT practices that have equipment that are unused. So yeah, asking the question like, is there something in my site now that I could be using that I'm not? And why? Is it because the batteries are located on the other side of the office away from the device? Like simple stuff like that. So that's kind of your best chance at implementing technology, is the technology you already have. Because we know how it goes as a PT, you ask for things, it takes time. Um, Budgets are particularly tight at, these current times. So start with what you have,
Sure.
but that's kind of a lame answer. I find that clinicians who are really successful in promoting adoption of advanced technology do so methodically, and with some research. So, you know, as a company, Wandercraft is engaging these conversations with clinicians or sort of advocates for technology. So, ask if, what do these numbers look like for a clinician or a clinic our size? But it's beyond that, really. It's kind of like taking the evidence, saying this is what we should be doing to improve patient outcomes. This is what we think it will do. Let's say inpatient rehab, for example, from like maybe mobility scores or things that hospital administrators care about, because oftentimes there's a dollar attached to it. Not always. They also care about their patients, but showing a shortcoming because you don't have the technology and advocating for what it would be doing for the whole hospital, not just for your practice, because they care about you, but they also care about the whole hospital.
So putting it in perspective from everybody's KPI.
Exactly. Yeah. Yeah. Think about what they care about. And they care about more than dollars, but it's a big, they consider it heavily. So
Sure.
Yeah, that's for sure.
Here's the truth. You do the work, you care for patients, you fight through schedules, documentation, and the chaos of healthcare. So why shouldn't you get paid on time? That's where Athelis RCM comes in. It's billing, but smarter, AI-powered, fully automated, and it integrates with your existing EMR. It handles everything from claims to denials and revenue reports. It's like hiring an entire billing department without hiring an entire billing department. And providers are raving about how much time they get back. Not to mention 15 to 20% boost in collections, not too shabby. So yeah, you can have fewer headaches and more money. Just book a demo at athelis.com. That's ATHELAS.com, and see what your billing could look like when AI has your back. Yeah, whenever we talk about this, I think of the movie Moneyball, which is like in that movie. Did you ever watch that one?
I have, yeah.
Long time ago. With Brad Pitt and in the old school scouts, and he's in the room telling everybody how he's going to get rid of these certain players. And ultimately they broke down, like, if you want to win, which is everybody's goal, the goal is to get on base and score runs. Like, that's how you win baseball. Like, get on base and score runs. If you try to win by changing and managing for everything, defense and pitching and saves and ERA, it's too much. Right. Yep. So they broke it down in Moneyball. And of course, like, it would have been really poetic if they had won the World Series that year. It would have proved Moneyball. Right. But it said, well, especially baseball is a good example, but so is healthcare. We can measure a lot. Mm-hmm. So then are you just trying to change stats, or are you paying attention to what the outcome is? And paying attention to money isn't necessarily a bad thing, because if we can do it better with money, we can do it for more people, or we can do it, better. But paying attention to what everybody else's KPI, that's the way to get people on your side. And I'm using air quotes, on a podcast, which is like how to get them to see things from your perspective. Is this thing that I want this cool device. Look at this thing. I want this in my clinic. How do I get it here? Is it just pretty? Yeah. Well, let me show you what this is going to do 369 months from now, or 369 years from now, if we have it in clinic.
Yeah, for sure. And I think that it goes even like that. Let's say you get it, what's the next step? Because I think the frustrating part for hospital networks or PT practices even is they invest and they say, that's great, we're all in. And it starts being used and then it fades over time. You hope not. But I mean, the best technology in the world, unless you have an infrastructure that supports it, will likely fail or won't be used at its optimal level.
Yeah. Yeah.
And you're starting to see this shift where, like in this space, that hospitals are no longer getting innovation at a significant discount like they maybe used to. And so they're, let's say it's a bad thing for hospitals. Hospitals now have to pay. But I think you can even spin it the opposite way, is that when hospitals or private PT practices, anyone, when they pay for technology, the motivation is so much higher. And you think, oh, well, administrators are the ones paying or making the decision to pay. It won't, the PTs won't feel that. They'll treat it the same way. But you see this like motivation that comes top down, because it's like, we chose to invest in this technology because we care about our patients, we care about our outcomes. Let's make it happen, whether that's by having a specialist who is like a champion for the technology, to really make sure that we're removing barriers to adoption. So I think you're seeing that hospitals are investing in the technology, and they're really thoughtful about what they're investing in. And then they're pushing it to make sure it actually is they'll see the outcomes that they were promised by that one staff PT who was like, please just bring this technology. So you see this kind of motivation that comes from having to invest in innovation. And then outcomes improve if you're using it in an evidence-based way. And everyone, as you said, everyone's happy there.
Yeah. What question didn't I ask? What's something that usually comes up in conversation with healthcare providers that I didn't ask that normally comes up that you find that saying
in terms of
helps them understand?
Like administrators asking, why this technology is that?
Yeah. Why? Yeah. I would say the why, like, what didn't we get a chance to let you say that? Usually I always say it's the eyebrow moment when they hear it from you, right? Like, you're going to go on stage and you're going to give a presentation on this. But the funny part is the real interaction comes afterwards, when 5 or 6 people come towards you when you're done. And then they go, well, how about this? What's the thing that makes them go, huh, okay. Like that eyebrow raise moment.
It's tough. We're so far into it.
You could
It's
just
hard
repeat something you've already said. Like if you've already said it, that eyebrow raise moment, you can say it again. Like, I'm not looking for you to invent something.
Yeah, no, I think it really boils down to market access principles of like and the KPI thing you said resonated with me as well. Like putting yourself in the shoes of the audience, and like, what do they really want? You think about like principles of negotiation, or once you figure out what the other party wants,
Right.
you're in such a better position to negotiate.
Yep.
And it's not that you're negotiating the way you are.
Oh, you're 100% negotiating.
Yeah, it's just the truth. You are. Once you understand what the other person really wants, you can position your argument in a much better way in terms of advocating for technology. And I'll kind of I'll circle it back to Walk in New York, because that's what's interesting, is like when we're setting up the type, and we wanted to understand what people want. And people want advanced technology. There's multiple studies that have showed that individuals with spinal cord injury want to use exoskeletons in their practice. They see it, and that's cool. Could that work for me? And as the technology is advancing, the answer is increasingly becoming, yes, this technology can work for you in some capacity. So we know they want technology, whether it's exoskeletons or, with virtual reality, which we also have at Walk in New York, or, we have a mirror therapy device. So we know they want it. And then for us, it was like, how do we make a clinic in a way that will allow them to access it? So that's what maybe the eyebrow moment is like, we've taken a position that we want to be in network with insurances. So we're in network with Medicare already, multiple private payers, pending Medicaid, because we want patients to access it, and that we see cost as a big barrier, not only for the hospital networks and the private practices, but also for the patient.
Sure.
If self-pay is the only way, try it as possible, but to use it on a regular basis, that you'll start to see the outcomes that you want to see. Cost becomes a major barrier. So I think for patients too, when we say, oh, we're in network with major insurance providers, Medicaid, others, that's maybe the eyebrow raised for both clinicians who know what they're doing in this space, and also they're not used to hearing that.
Well said. All right. Last thing we do on the show, Josh, is called the parting shot. What's the last thing you'd want to leave with the audience as we wrap up? Idea, soapbox statement, mic drop moment, whatever you want it to be.
Yeah. I think no soapbox, no mic drop. I just think love for people to reach out. I think Walk in New York is creating waves in the space, and people are asking questions. What is it? Who's it designed for? It's designed for patients with any neuro diagnosis, not just spinal cord injury. So from clinicians to patients, I'd love for them just to reach out to us and ask the questions. PTs are curious, and we want to talk with them about what we're super transparent about it. And we want to create a place that clinicians can come on board and grow in a way that's sustainable. And we think technology is part of the path there. So anyone who hears this and is interested, my LinkedIn is super public, and I love engaging with people there, or by the website, there. Reach out. We'd love to hear from. And I know this podcast has a wide reach, so certainly grateful to have the chance to come on and chat with you, Jimmy, because I think it starts to improve awareness about possible.
Good. Josh, appreciate the time, man. Thanks for doing what you do. And next time I'm in the city, look for me, fogging up the windows. I'll be there, just kind of peeking
perfect.
in. I'll be the guy.
We love that.
Right there. I like that.
We love that.
Josh, Walk in New York. Appreciate your time, man. Let's be real. You didn't become a therapist to be average. You've got something in you that wants more mastery, more impact, more confidence in the clinic. That's exactly what Brooks Institute of Higher Learning delivers. Their residency and fellowship programs aren't just resume builders, they're transformation zones. You get one-on-one mentoring, deep dive classwork, labs, and real-time experience inside one of the most advanced rehab systems in the country. And the best part? You're not grinding this out on the side. You get a full salary and benefits while you train with the best. Whether it's ortho, neuro, peds, geriatrics, women's health, Brooks IHL helps you become the expert you're meant to be. Check out brooksihl.org to learn more and take that next step.